Saba Memon. I'm an endocrinologist. As we all know, endocrinologists are specialists who deal with problems involving hormones. And diabetes is the most common hormonal disorder which is widely prevalent. It is caused because of problems in the action of insulin. Today, I'm here to answer the question on what are the differences between type 1 and type 2 diabetes. As we know, diabetes is a condition which is characterized by a high blood sugar levels. Then, how can there be different types of this high blood sugar levels? Well, the pathophysiology defines the types. That is, in diabetes, the blood sugar levels are high because insulin cannot act. And this insulin cannot act because either it is not being produced or it is being produced but is not able to actually work on the cells. And this exactly is the difference between a type 1 and a type 2 diabetes. In type 1 diabetes, the body is unable to produce any amount of insulin whatsoever. So these patients will have very high blood sugar values and they can never be controlled on any medicine other than insulin. So these patients are insulin dependent, and this is what we call as type 1 diabetes. Whereas type 2 diabetes, these patients have insulin in their body, but the insulin is not able to act at its target sites. And this mainly happens, and it is related to weight gain and obesity. When we gain weight, there is an increase in amount of fat in the body, and this fat interferes with insulin action. So what the body does is it produces more and more insulin to overcome this resistance. And at one point, this compensation cannot take place any further and the patient's blood sugars start increasing. So, having understood the basic difference between type 1 and type 2 diabetes, let us understand how this difference in the mechanism of diabetes translates into a clinical difference. How, on seeing or looking at a patient, can we decide whether this patient is insulin dependent type 1 or an insulin resistant type 2 diabetes? The first and most common difference is the age at presentation. Patients with type 1 diabetes present within the first 2 decades of life, usually in the first decade between 5 to 15 years of age, whereas type 2 diabetes presents later in age, usually around 40 to 60 years of age. And however, this difference is not absolute. As I said, type 2 diabetes is related to weight gain. In current era, we are increasingly seeing younger children with a lot of weight gain and obesity. Literally, adolescents coming with 80 and 100 kgs of weight. These adolescents can develop diabetes even at younger age group. So, age is not the absolute criteria to define type 1 and type 2, but yes, if you're presenting at a very young age, there is a high likelihood that you could have a type 1 instead of a type 2 diabetes. The presentation is again markedly different in both of these groups. As in type 1, there is no insulin production whatsoever. Suddenly, the body is unable to manage any amount of glucose and hence they present abruptly. The moment the diabetes has begun, they will have clinically presented with it. Whereas in type 2 diabetes, they will have high blood sugars for a long amount of time, unknown, unnoticed, unless it is suddenly tested on a routine value. Yes, even type 2 diabetics can be symptomatic, but they can still have a longer duration of preceding undiagnosed diabetes. But what is other than the abruptness is the fact that the type 1 diabetes, because of an absolute insulin deficiency, presents in a serious condition called as a diabetic ketoacidosis. What happens is that because there is no insulin and the glucose levels go so high that all of these glucose goes away through urine and the patient becomes severely dehydrated. And in such condition, when there is no water in the body at all, in the face of very high glucose, these patients become very, very serious. They are unable to breathe. They will have vomiting and they get admitted with ketoacidosis. So if the person is admitted with severe hyperglycemia, breathlessness, and having ketone positivity, they are likely to have type 1 diabetes. Other than this, type 1 diabetes will be thin and lean persons, whereas type 2 are going to be on the heftier side. And it just need not be an absolute increase in weight, but even an increase in abdominal obesity will also predispose to type 2 diabetes. Well, the investigations and management are going to differ in both of these types of patients. Type 1 patients will have no insulin production and hence very low C-peptide. They can have positive antibodies, which are the reason why they have been shifted, why they develop diabetes. And they can have other autoimmune conditions like thyroid and celiac abnormalities, whereas type 2 diabetes will have other problems related to weight like cholesterol abnormalities, heart conditions, fatty liver, and so on. So the pathophysiology of diabetes is very, very different, and it is not just the mechanism, but the age at presentation, the type of presentation, the presence of ketones, very low C-peptide, and a lean body weight will make us think that the patient is having type 2 diabetes. I hope I have cleared the basic difference. Thank you for your attention.